Thank you, everyone. So we're going to switch gears now and look at good nutrition during and after treatment. So today we're going to look at benefits of good nutrition, foods to eat during treatment. We'll also look at some nutrition tips for people with urostomies. We'll look at strategies to maintain intake, safety tips for fighting illness and infection, blood-building nutrients, some hot topics, and diet and health guidelines. And then we'll have some time for some questions. Why is good nutrition important? First and foremost, it helps you to maintain your weight. Good nutrition provides your body with fuel to give you energy and strength. It will help you better tolerate side effects such as fatigue, as well as help with bowel function. Good nutrition can boost your immune system to help fight illness and infection and helps your body heal and recover faster. In addition, along with other healthy lifestyle practices, good nutrition can help prevent or manage other chronic diseases. What to eat during treatment? Eating well means eating a variety of healthy foods, including vegetables, fruits, and whole grains. Nutrient requirements increase during treatment, and at the same time, eating may become more difficult. You want to make sure you're getting enough calories, including protein in each meal and snack, and drinking enough fluids. We're going to start with calories. There are calculations to estimate the number of calories you should be eating per day, but this number can vary from person to person, as well as the type of treatment you're receiving. The best way to know if you're eating enough calories is to weigh yourself regularly. If you have a scale at home, even if it's an old one, get on it. The number itself doesn't matter. You just want to make sure that number doesn't go down or up too much. If the number stays the same, it means that you're eating enough calories. If you find that your weight is going down, there are certain foods that can help boost calories during the day. You can add cheese to omelets, sauces or casseroles, include nuts and seeds in yogurt, baked goods or stir fry, or enjoy avocado in sandwiches, salads, or even smoothies. The booklet, Eating Well When You Have Cancer, which you can find outside, grab one of those, has some excellent ideas for boosting calories in your day. Next is protein. Protein requirements increase with cancer and cancer treatment. Protein helps to keep your immune system strong, for the growth and repair of tissue, and to help prevent muscle breakdown. The 5-star protein choices you see there are foods with high amounts of protein per serving. They include meat and fish, poultry, milk products, nuts and seeds, nut butters, egg, tofu and soy beverage, and legumes. Next is fluid. All cells in our body require fluid to function, and more fluid may be required if you're experiencing vomiting or diarrhea. Staying hydrated can also help ease symptoms, including fatigue, constipation, or dry mouth. If you find it difficult to eat or you're losing weight, choose more fluids with protein and calories. You'll see in this chart the fluids with calories and protein in the first column include soups made of milk, legume, meats, fish and chicken, milk or yogurt drinks, smoothies, or nutritional supplements, for example, Ensure or Boost. For people with a urostomy, I want to stress again, and Debbie had mentioned it, the importance of staying hydrated and drinking enough fluids. To help limit bacterial growth and by keeping urine acidic, include foods that are high in vitamin C. They include cranberry juice, soft berries, citrus fruit, and blackcurrant cordial. To reduce odor caused by certain foods such as asparagus or fish, have a glass of tomato juice. Medications can discolor urine, as well as certain foods, beetroot, radishes, spinach, or certain food dyes. Dark urine may be a sign of dehydration, and more fluid may be required. And dark, odorous, or cloudy urine may be a sign of infection, and it's important to check with your doctor if there's any concerns. Side effects from treatment can vary. If you're finding it difficult to eat, try eating smaller, more frequent meals instead of 3 big meals. Drink fluid and eat food separately so you don't fill up on fluids. Stay active. Even a short walk can increase appetite. And plan ahead. Freeze your favorite meals into smaller portions. Stock pantry with easy-to-make meals and snacks. And ask family and friends to help with food preparation or groceries. A weakened immune system can reduce your ability to fight illness and infection. Take extra care. Wash hands often and keep kitchen surfaces, appliances, and dishes clean. Cook foods at proper temperatures. You can use a meat thermometer. Keep hot foods hot at 60 degrees Celsius or 40 degrees Fahrenheit, and cold foods below 4 degrees Celsius or 40 degrees Fahrenheit. Avoid raw or uncooked meat, fish, and eggs, unpasteurized milk and juice, untreated well water, and uncooked sprouts. And when in doubt, throw it out. Don't eat food that's spoiled, out of date, damaged, or bruised. Low blood count. There are certain nutrients you can add to your meals to help with blood formation. They include protein, iron, folate, and vitamin B12. I've listed some of the foods here on this and the next slide. I'm not going to go through them. There are some variation or some similarities with some of them. Out in the front, there are some handouts, so if anybody's interested, feel free to get one. So these are the protein, which we've talked about, high iron foods, high folate foods, and vitamin B foods, vitamin B12. Next, we're going to look at some hot topics. The first hot topic we're going to look at are phytochemicals. The word phytochemical comes from the Greek word phyto, meaning naturally occurring plant chemicals. Phytochemicals may help stimulate the immune system, repair damaged cells, and have possible disease-fighting properties. Phytochemical serves as natural protection for the plant and gives vegetables and fruit their color and fragrance. The best way to provide your body with phytochemicals is to eat a variety of vegetables and fruit. Next is red meat. Recently, there's been a lot of negative coverage regarding meat and processed meat. Studies have found that diets high in red meat and small amounts of processed meat can increase your risk of colorectal cancer. It's important to note that it's difficult to generalize studies on red meat and cancer due to the various definitions of red meat. The American Institute for Cancer Research recommendations to reduce your risk is to limit cooked red meat to 18 ounces or 500 grams per week and avoid processed meat. According to the AICR, red meat refers to beef, pork, or lamb, and processed meat refers to meats that have been processed by smoking, curing, salting, or any other chemical preservatives. Next is dairy. Drinking milk helps to maintain good bone and dental health. Studies have shown that milk protects against colorectal cancer and may reduce the risk of bladder cancer. To date, there's not enough evidence to recommend the use of a calcium supplement for cancer prevention. The recommendations for calcium in Canada for men and women ages 19 to 50 is 1,000 milligrams, and for ages 51 plus is 1,200 milligrams per day. Here are some, oops, that didn't work. Here are some dairy choices, including the amounts of calcium per serving. When picking a yogurt, try choosing one with at least 25 to 30% calcium on the label. Sometimes that's easier said than done when comparing labels in grocery stores. Here are also some non-dairy choices that can help add calories or add calcium, or if you don't tolerate milk, to include calcium in your diet as well. It's interesting, the kind of varied list. If anybody wants a more comprehensive list, you can go to Osteoporosis Canada or Dietitians of Canada, and there's a longer list there. It's true. Next, we're going to look at sugar. Questions around sugar are common. Before we get into the relationship between sugar and cancer, I'm going to briefly review how sugar is used in our body. Sugar and starches are dietary carbohydrates that break down to their simplest form, glucose, fructose, and galactose, to be used by all cells in our body. Glucose is the main source of energy, and certain cells in the blood, red blood cells and the brain, rely solely on glucose. Blood sugar levels are tightly regulated in our body. When we eat carbohydrate, our body releases a hormone called insulin. Insulin removes the sugar from our blood. The sugar is used for immediate energy or stored for later. It's important to note that you can't starve a cancer cell by eliminating carbohydrates from your diet. Excessive sugar intake, however, can increase cancer risk in two indirect ways. Number one, when blood sugar levels are not controlled, typically people with diabetes or who are insulin resistant. Over time, high blood sugar levels may result in circulating insulin, which can promote cell growth. Number two, excessive sugar intake, similar to excessive protein and fat intake, is excessive calories, which can result in weight gain. We do know that excess weight is a risk factor for cancer and other chronic diseases. Bottom line on sugar. Small amounts of added sugar can be included as part of a healthy diet. For more gradual effects on blood sugar, pair sugar with a protein and/or healthy fat, and choose carbohydrates including vegetables, fruit, whole grains, and legumes. According to the American Heart Association, the recommendations for added sugar for women is 6 teaspoons a day, and for men is 9 teaspoons per day. And look out for added sugar on labels. They include table sugar, high fructose cornstarch, honey, maple syrup, and generally any ingredient you would see on a label ending in OSE. The last hot topic we're going to look at is alcohol. Studies have shown that alcohol consumption can increase the risk of certain types of cancer. Drinking alcohol may interfere with treatment or medication, so it's important to speak to your doctor. According to the American Institute for Cancer Research, the recommendations to reduce your risk is no more than 1 glass of alcohol for women per day and 2 for men. According to the American Institute for Cancer Research, a drink is considered a 5-ounce glass of wine, 1 bottle of beer, or a 1.5-ounce cocktail. Healthy tips to reduce your risk of recurrence and to prevent or manage other chronic diseases: eat a mainly plant-based diet, including a variety of fruits and vegetables. Limit red meat and avoid processed meat. Choose low-fat dairy or other calcium-rich foods. Choose moderate amounts of healthy fats and oils. Include fiber in your diet. Limit alcohol. Reduce sugar and salt. Be active and maintain a healthy weight. If anybody has any questions for a dietitian, you can visit Patient and Family Support, book an appointment, drop in. There's lots of resources there. We can answer any of your questions, concerns, and help manage any food-related challenges. Thank you very much.